serious concerns regarding states' arrangements.
Thought it was on already. To fund the non-federal share of Medicaid, which could inflate federal costs significantly. Could you elaborate on the types of arrangements that pose the greatest risk to Medicaid's financial integrity and what GAO recommends to address these vulnerabilities?
Yes. There's a couple of things. One, on the supplemental payments that could be made over and above reimbursement for claims or capitated rates, the states can impose taxes on providers. And then they collect the revenue from the providers as a means of meeting the state requirement for the state share of the Medicaid program. So there's no state money involved in those cases. And then there are payments made and the federal government matches on the payment thing. So over time, it has a couple effects. One, it kind of erodes a little bit the joint responsibility that was envisioned in the federal and state responsibility for the Medicare program, and it subtly shifts some of the costs to the federal government over a long period of time. So it's those provider taxes and other things that are done that are really one of the revenue sources. We've recommended there be more transparency over this process so that there's more reporting of these supplemental payments or the state-directed payments.
Well, let me just ask
Yeah,
you about
sure.
the transparency. What specific actions can Congress take and the administration undertake to enhance that transparency and accountability in how they report their financial sources for Medicaid?
Yeah. Well, I think Congress can impose requirements that make it clear that they're to report those requirements. Right now, the CMS has acted on our recommendation, and they're providing more reporting, but they're not reporting on where the sources of the funds are coming from for making the supplemental payments. That is information I think needs to be reported. And if CMS doesn't take full action on our recommendation, I'd recommend Congress do so.
Agreed. Mr. Hill, MACPAC just voted last week to recommend that states should be required to disclose their funding sources for the non-federal share of Medicaid. How would this added level of transparency benefit the program's fiscal management?
I think for the reasons that were just discussed, having a better understanding about not only the supplemental payments, sort of the payments that are being made to providers where Congress has already required reporting and CMS is collecting data, but having that combined complementary understanding about where the source of those funds are. We assume for the moment that it's a legal appropriate source of funds, but knowing how they're financed and what they're supporting and how it is the state has viewed those arrangements in terms of driving economy and efficiency and quality for patients is important. And right now it doesn't exist, and having that data reported and elevated and made public, I think will expose some of that and give us all a better understanding about how those arrangements are set up.
Yeah, as you were talking, I just remembered when I was in the state legislature and we were trying to pass, the General Assembly was trying to pass a cigarette tax for the intent purpose of chasing Medicaid dollars and 3-to-1 match on state dollars spent. So it was just about increasing that spending. Mr. Graham, from your oversight perspective, what improvements can HHS implement to monitor and regulate state methods of reporting Medicaid funding, particularly to curtail abuses involving provider taxes and intergovernment transfers? So I'll go to Mr. Graham, Mrs. Graham for that. I'm sorry.
Our work is consistent with what has been described. We refer to as state financing mechanisms where states are getting money from hospitals and purportedly using that money to do things like improve quality in nursing homes, and we're not necessarily seeing those outcomes achieved. So additional oversight, additional reporting, additional assessments would be helpful.
My time's expiring. Mr. Chairman, it's a great informative hearing here, and I appreciate you having it. I think it's bipartisan on our approach, and I yield back.